Coalition at Harbor UCLA Medical Center. It's a public hospital serving over 700,000 people in San Pedro, Wilmington, and throughout the harbor in South Bay. I'm here proudly representing Physicians for Social Responsibility Los Angeles, one of the founding organizations of the Stand LA Coalition. I'm also here representing CIR, our union, a committee of interns and residents. As a physician working in this community, I have personally seen and heard from community members suffering the health effects of the fossil fuel industry. We know that there are nearly 500 active oil wells in Wilmington alone, plus 9 oil refineries in the harbor area. This is in addition to the pollution caused by our freeways, trucks from the nearby ports, and other sources. Specifically, the Wilmington-Carson area has the highest concentration of oil refining activity in the entire West Coast. Wilmington is also home to the largest port complex in the country, accounting for the biggest air polluter in the region. We regularly see patients suffering from asthma, other respiratory problems, heart disease, cancer, and premature death. Conditions that are associated with the exposure to dangerously high levels of known chemicals used in extracting and refining oil. Take just one chemical commonly used, benzene. It is widely known to cause AML, or acute myeloid leukemia, in adults, with some evidence suggesting that it's associated with the development of childhood cancers. According to the American Cancer Society, breathing in benzene can affect the nervous system, leading to dizziness, headaches, tremors, confusion, and loss of consciousness. If ingested, benzene can cause vomiting, convulsions, rapid heart rate, and in extreme cases, it can be deadly. It is now common sense, based on a mountain of scientific evidence, that oil production does not belong anywhere near homes, schools, and other sensitive land uses. So why do they still remain in communities like Wilmington and South Los Angeles? Communities like Wilmington are comprised of more people of color, with lower average income, and less access to adequate health care, resulting in an even greater risk of chronic disease and increased vulnerability to the effects of these environmental exposures. These communities have not been subject to the same protections as other communities in Los Angeles. We are raising our voices as doctors in solidarity with the impacted communities here today to demand of our elected officials no more sacrifice zones in communities like Wilmington. No more environmental racism. It is time for our elected officials to listen to and acknowledge that their constituents, the people who voted for them and trusted them, are suffering greatly from the exposures they can protect against. It is time our elected officials hear the call of scientists and medical professionals alike. We call on Councilmember Buscaino and the entire Los Angeles City Council, as well as LA Mayor Eric Garcetti and Governor Gavin Newsom, to publicly support a 2,500-foot buffer zone that would phase out neighborhood oil drilling. We call on them to create a plan for an ambitious, responsible, and just transition off of fossil fuels. We call on them to put public health and environmental and climate justice before corporate profits. Our healthcare systems and our communities cannot continue to afford this detrimental and costly addiction to oil. The communities I serve cannot continue to suffer the health consequences of a very dangerous practice especially when there are safer alternatives. Thank you for being here.